Good morning, good afternoon, good evening. On behalf of the Department of Population and Public Health Sciences at the University of Southern California, our chair, Dr. Howard Hu, and Sophia Greskin, the director of the Institute on Inequalities and Global Health, it's my pleasure to welcome you to this panel on conflict, the response, and health equity through the lens of Ukraine. My name's Jonathan Cohen. I'm a clinical professor and director of policy engagement with the Institute. I have the pleasure today of moderating a discussion among four esteemed experts on conflict and public health, prompted by, but not limited to, the Russian invasion of Ukraine nearly 8 weeks ago. Having personally worked for many years to develop public health programs in Ukraine, in my former role with the Open Society Foundations, I was among many who feared this progress would unravel as a result of Russian military aggression. What we have witnessed in the past weeks is indeed a public health crisis, but just as importantly, an extraordinary show of determination among Ukrainians to protect their health system, to adapt to the realities of war, and to continue pushing for the realization of universal health care for all. Joining us today are four experts who will help us understand this crisis in its global dimensions. We will begin with brief remarks from Dr. Tetiana Stepurko, a Ukrainian sociologist and health policy expert joining us today from Kyiv, whose research has encompassed informal patient payments, satisfaction with and corruption in healthcare and education, and access and quality of healthcare services in Ukraine. Tetiana currently leads the Project Implementation Office of a Ukrainian-Swiss project on development of medical education in collaboration with the Ukrainian Ministry of Health. She is also an associate professor at the National University of Kyiv-Mohyla Academy and has been involved in the Mohyla School of Public Health since its launch in 2001. I'm going to introduce all of our panelists at the beginning. Following Dr. Stepurko's remarks, I will pose a round of questions to three medical and public health experts with experience both in Ukraine and globally. I'll begin with Dr. Zaher Sahloul, a Syrian-American physician, founder of the medical humanitarian organization MedGlobal. Dr. Sahloul graduated from medical school in Damascus, where he was a classmate of future President Bashar al-Assad, after which he moved to Chicago, where he is now a critical care specialist at Christ Advocate Medical Center. His work for MedGlobal spans Africa, Latin America, the Middle East, and South Asia, and he recently returned from Ukraine, where his organization is training health providers and has distributed more than $500,000 worth of medical supplies and essential medicines. I'll then turn to Dr. Michele Heisler, who is the medical director at Physicians for Human Rights and a professor of internal medicine and of public health at the University of Michigan. Dr. Heisler has participated in multiple Physicians for Human Rights field investigations and co-authored reports since she was a medical student in the mid-90s. Throughout her career, she has applied cutting-edge research methods to investigate the health impacts of human rights violations and to advocate for remedies, including in multiple conflict settings. And finally, we'll be hearing from Dr. Michel Kazatchkine, a French physician, diplomat, and advocate who is currently the United Nations Secretary General's Special Envoy for Eastern Europe and Central Asia. An expert in the former Soviet Union and fluent in Russian, Dr. Kazatchkine is internationally renowned for his efforts to advance the health and human rights of marginalized populations, including as a past executive director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Among his many efforts in Ukraine, Dr. Kazatchkine was instrumental in ensuring continuity of HIV and tuberculosis treatment following the Russian annexation of Crimea and occupation of the Donbass in the aftermath of Ukraine's Revolution of Dignity in 2014. If time permits, after hearing from these extraordinary speakers, we will open the floor to questions, and Dr. Hu will close our event at 10 a.m. Pacific time. So Tetiana Stepurko, allow me to begin with you. You're calling in from Kyiv. You are facing this crisis as a Ukrainian who has worked so hard to reform your country's health system. And you have a few key messages that you'd like to convey to our audience today. Over to you.
Thank you, Jonathan. It's a great pleasure to join this conference, this meeting. For me, it's a first professional and scientific event during the from the beginning of war. So I'm a bit nervous, but also I'm confident that a lot of attention Ukraine has now, and it brings some more confidence that the things that we are facing now will maybe end soon and will have some positive impact on all the areas which we are involved now. Recently, I participated also in a workshop where the definition of crisis was given, and it was something like turning a point of a disease, if we're talking in the area of healthcare, when an important change takes place, and that leads either to recovery or death. So the crisis has some functional meaning for all of us. But in Ukraine, we are mostly talking that we are in war with Russia, and we are defending our country, and the war perhaps has a bit stronger and with some more sense connotation then. So I would like to briefly describe perhaps pre-war and war-related status of Ukraine, because it was very important that we entered, we were pushed to enter the war, but we did a good home task. So since I would say Soviet Union collapse, Ukraine during 30 years did a lot of great things, though having some corruption on the background, some economic issues and others, but the public health related issues are very important in terms of healthcare reform that Ukraine has implemented since 2018. And I'm very happy that I worked at the School of Public Health of Kyiv-Mohyla Academy, where 18 years ago, great minds worked, studied, and also were lecturers, and they were one of the driving forces of healthcare reform. So graduates of our School of Public Health were designers of health financing reform. They became heads of National Health Service of Ukraine and so on. Perhaps I will briefly describe why the health reform was very important. With previously line item budgets, with the lack of the rules, with very unclear responsibilities of the state funding and facilities, in 2018, we got family doctors or general practitioners in our country. It doesn't really matter. The idea is that people got a clear idea where the services can be obtained as the first point of entry to the system. And it certainly is very relevant to immunization. That was the most important thing in 2021 after the first COVID year. Cardiovascular diseases has been better addressed through more transparent procurement of medicines and free of charge access as to the services, as to pharmaceuticals. So practically, I would say that from 2018, people got very clear understanding how the services should be consumed by them. So the access to the services has become much easier to be obtained in terms of financing, in terms of geographical accessibility. So people could select their family doctor, general practitioner, and now in these work conditions, we see that, and also from the COVID crisis, we see that it was a really great effect on the accessibility of healthcare services, because people and me personally as well, when I was staying in Poland first weeks and in the Netherlands, I could access my family doctor through Viber, through other means, asking some questions, what shall I do in this or in the other situation? And certainly those medical doctors, even who were in the occupied territories, but still had internet connection, they were pretty much responsive and supportive to all the patients. Though now, with also reform, we got a great improvement. It's electronic medical record system, which didn't really work during the first weeks of war, and now it's more or less, I would say, again returning to its functionalities. Considering that Ukraine has not really strong institutions and the governance could not be characterized as good, rather poor, we have rather great bottom-up initiatives from civil society. We could observe this during Revolution of Dignity that took place in Ukraine in 2014. And in 2014, it was first Russian invasion to Ukraine. And since that time, I believe that healthcare providers, those tactic medical workers who are also providing care to paramedics and so on, they did a lot of home tasks during these 8 years. So when the war started 8 weeks ago, we see that much more understanding on triage, on what kind of medical devices should be available, though there is a huge lack of them. And practically most of the processes that were related to conflict, to military conflict, they were already among the knowledge about this was among the professionals. As far as I understand, I have 1 more minute, 2 more minutes to illustrate several more things that are relevant to the health of people and the overall system. Now we, with the different means of civil society, try to support those who are lacking many different things, starting from water in the occupied territories to medicines. And since at the beginning of the war, the pharmaceutical provision was really interrupted pretty much because of the logistics and many other things. So a lot of people with the diseases like cardiovascular disease, mental issues, and so on, they have been in trouble because they didn't have really access to the pharmaceutical things. Moreover, what we see now, and here perhaps we will need much more time to reconsider and to understand what kind of impact we have after the invasion of Russia to Ukraine. We're talking here about violence, not just physical violence, but also sexual violence that is linked to sexually transmitted diseases, not to mention mental related things, trauma, and so on. And certainly Ukraine has some human resources to address these issues, like psychologists who work with with people who have this trauma and rather negative experience of who from the territories occupied. But we do not really have the data of understanding how many professionals do we need, how many people who need certain services. And it's not just because of the lack of institutions or processes, it's just the work conditions that doesn't allow us to assure rather fast data collection and responding to it. So I believe that on the territories where the conflict or which are not already, which are freed from Russian militaries, this like Bucha and other districts like Chernihiv and Sumy, Perhaps in several weeks, maybe Ministry of Health of Ukraine will give us some numbers about the needs with regard to health services and social medical care to be addressed. And here we're not talking about air pollution, about other really forbidden weapon and means that Russians are using. So this is about one health which is also about agriculture, about safety, about mines and so on. And I believe all the listing all of these issues and organizing the efforts would be one of the main public health related issues of the next years. But now having the good history, the good experience in terms of Ukrainian resilience to economic and many other things which we experienced, now we consider perhaps this is as a new challenge that may bring the system, public health system and many other systems to a bit stronger condition, more shaped and crystallized. The only thing that we need is to have finally the peaceful environment to start rebuilding and reconstructing all the areas that were damaged, and they are continuously being damaged now by Russian army and perhaps media and other aspects. So, but we would not be able to stand up without great support of international partners, and so that's the great example how partnership and collaboration is taking place. So here I also would like to thank to the attention and for this meeting that we're having now, and glory to Ukraine.
Thank you so much, Dr. Stepurko, and we will return to you. We know there's so much more to say. Dr. Sahloul, I'm going to start with you. We all dreaded another Syria. It's painful even to ask this question, but having worked to bear witness and mitigate the health effects of the war in Syria, having recently been to Ukraine, heard from Dr. Stepurko, can you comment perhaps on some of the similarities and differences that you're seeing between these two contexts?
Well, good morning. Thank you, Jonathan. I'm really humbled to be among this esteemed group of speakers. And Tatiana, we pray for your safety and the safety of the Ukrainian people. You know, this brings nightmares to me. You know, what's happening in Ukraine has happened in Syria over the past 11 years. Maybe it's the same scale, I would say. I mean, the scale of the displacement that we are seeing in Ukraine, similar to the displacement that we've seen in Syria. In Syria, half of the population have been displaced. We still have 6.5 million refugees. Over the past 11 years, I mean, there is still displacement happening in Syria. Refugees did not go back even after 11 years because of the destruction of their cities and neighborhoods by Assad regime and Russian air forces. Russia has experimented in Syria, according to their Ministry of Defense, more than 319 different new weapons, which they are using right now in Ukraine. They also tested more than 68,000 soldiers in Syria on urban warfare, which now they are unfortunately doing the same thing in Ukraine. The recent general who is overseeing the operations in Ukraine was in Syria, the Butcher of Aleppo. That's the nickname of that general. And also they're using the same tactics that they have used in Syria, that siege of the population, like what happened in Aleppo and Ghouta, which basically putting siege around cities. We're witnessing that painfully with Mariupol, forcing the population to leave or be displaced, leave their neighborhoods and cities, destroying their buildings. That will create a lot of impact on health, short-term or long-term, with severe malnutrition on the children, mental health, psychological trauma, and patients with non-communicable diseases that will be ignoring their conditions, and all kind of effect long-term. And also potentially the use of chemical weapons. So I believe that Syria was a prelude to what happened in Ukraine. And unfortunately, because of the lack of accountability to what happened in Syria, we're witnessing the same thing happening in Ukraine. Both are a huge humanitarian crisis, as Tetiana has mentioned. There's this location and this placement of population. There's destruction of social networks and ecosystems, destruction of livelihood, health, and social systems. There's insecurity, and there's abuse of human rights and random of violence and destruction in order to spread terror and fear and uncertainty. So that basically meets the criteria of humanitarian crisis in both situations. Both of them are complex humanitarian emergencies, because not only that you have large number of injured people flooding the emergency room and the hospitals in both cities, in both countries, because of the bombs and the missiles, but also because you have destruction of hospitals, because you have targeting of healthcare providers, because you have large displacement, and because you have also displacement of healthcare providers. That means people do not have access to a surgeon who can do appendectomy. Women who are pregnant will not have access to someone who can deliver naturally. So you will have increased rate of C-sections. We've seen that in Syria. We will see that in Ukraine. You will have psychological trauma that will not be treated. So all of these will be happening, and unfortunately happening in Syria. The social determinant of health because of the conflict are similar. You will have loss of human rights, which we're seeing in areas in eastern Ukraine and southern Ukraine because of the occupation. Because of the fear, because of the loss of dignity, because people will be starting over a new life without any tools to start new life. You have breach of medical neutrality. Unfortunately, this is something became as a norm, especially when Russia is involved. The Russian army is known not to respect medical neutrality. They bombed, according to Physicians for Human Rights, and I'm happy that we have a speaker from that organization. They documented more than 580 hospitals bombed in Syria. More than 930 doctors and nurses were killed in Syria. And the WHO in the World Health Day, ironically, documented the 100th attack on healthcare centers in Ukraine. And of course, we have progression from stress to distress to disease because of mental health problem. There's too many similarities, but I will stop on this, Jonathan, and maybe address other issues.
Thank you so very much. And Dr. Heisler, I know that Dr. Sahloul has touched on many themes that you're in such a good position to elaborate on, having seen firsthand as the medical director of PHR, the way in which war is fundamentally a determinant of health and of health equity. So having witnessed that in so many places, how would you like to elaborate on the points that we've heard?
Yeah, and I do. Again, as Dr. Sahloul so compellingly described, he talked a lot about Syria, but I feel that really the most chilling similarity between the invasion of Ukraine and many other conflict settings that we work on at PHR is indeed what seems to be the deliberate targeting of civilians and civilian structures, and including hospitals. And again, I just want to really hammer in, and especially so important for the public health, I'm sure there are a lot of public health students and clinicians here, is that to really recognize that I think what we definitely saw in Syria and other places, and I think is going to become even more apparent in the Ukraine, is that really the intent is likely, it's not just indiscriminate bombing, but it is really a tool of terror, a strategy to obliterate resistance, to terrorize the civilian population into giving up. We see that in the use of weapons like cluster munitions that scatter large numbers of explosive submunitions over a wide area to maximize the spread of destruction. And again, I think as Dr. Sahloul so compellingly described, really the closest similarity is with the extensive airstrikes and ground attacks on civilians that were indeed committed by the Syrian-Russian alliance against opposition-held areas in Syria. And again, this is not a side effect. These are diabolically effective weapons of war. And Dr. Sahloul noted how PHR and others, many with the assistance of Dr. Sahloul and other organizations, of just how many attacks on health facilities there were, as well as deliberate killing of medical workers. As he said, 942, and we still have many disappeared and who we don't know. So that number is an underestimate. I also really want to reinforce what Dr. Sahloul said, is that, you know, Syria and Russia have suffered no consequences or accountability for these crimes. And again, in Russia, it was also Russia's invasion of Chechnya. I mean, really grazing whole cities, deaths of thousands of civilians. You know, they've faced no accountability. They've committed these atrocities with impunity. So that's a huge challenge for the world. You know, as Dr. Sahloul mentioned, the World Health Organization recently reported the grim milestone of over 100 verified attacks on healthcare facilities in Ukraine. I do want to note, though, that this is not unique to Syria or Russia. Horrifyingly, throughout the world in recent decades, we're seeing more and more actors in conflicts learn this lesson about what an effective weapon of war it is to decimate hospitals, schools, as a way to terrorize and to achieve their war aims. I just want to expand the analysis a little bit beyond Syria and Russia. We know that from 2016 to 2020, there were reported more than 4,000 incidents of violence against healthcare in conflict areas. And these include Afghanistan, Iraq, Myanmar, Palestine, Somalia, Sudan, Syria, and Yemen, among other countries. So, you know, our colleague, both Tetiana and Dr. Sahloul have noted that the toll on local populations is devastating in both the short and long term. It can cripple entire health systems. You know, we actually see that in Tigray, an area of conflict that's not getting a lot of attention, where they've also targeted healthcare facilities. It impairs the ability to care for conflict-related injuries, to provide ongoing care. And I'm sure Michel will talk more about this in his comments. So I just want to end on this note that we can't neglect the human rights aspect of war, of these conflicts. The sad truth is that until we hold perpetrators of war crimes accountable, they will be emboldened to do worse. We've seen that with Russia. We're seeing this now. This has to stop. We as a global community have to ensure that the type of atrocities that Russia is now committing, and today committing more with their offense in eastern Ukraine, we just have to make sure that we mobilize to end this, so that they no longer have this absolute impunity.
Thank you so much, Dr. Heisler. I hope to come back to you on the accountability questions. Particularly appreciate your putting this in a global context. I think, you know, we do a disservice to the sacrifices of Ukrainians, frankly, if we don't point out the way in which this is also a crisis from Tigray to Yemen to Syria, and thank you all for conveying that so powerfully. Michelle Kozachkin, your long history of work in Ukraine and in the region gives you visibility into so many of the health effects of this conflict that people do not see, that are not getting the visibility or the political attention by the global community that they need. Can you help us see and understand some of those?
Thank you, Jonathan, and thank you for the invitation. I'm really thrilled to be part of this panel with the esteemed colleagues that are here today. Let me make 3 points here answering your question. First, I'd like to very much confirm what Tetiana said which is that we're starting in Ukraine with a country that has made major progress and has gone through major and courageous health reforms in the last few years that has really changed the funding of healthcare, the way data are collected, and the way public health policies are linked to epidemiology, the way the system has been decentralized to primary healthcare, and the way the public system has worked together with NGOs in providing healthcare in many, many settings. All of that has happened, though, on a fragile budgetary, institutional, and policy background in Ukraine, which of course makes it so much more vulnerable to the current crisis. My second point, and that's the first part of my direct answer to your question, Jonathan, is that I am very much concerned about what Dr. Sahloul told us about disruption in the care of chronic diseases. I'm very concerned about mental health. And as we are discussing human rights and war and health, mental health is there at the center. But also, and certainly because of my background and my areas of work, I am very concerned about infectious diseases. That is disruption of vaccinations. And we saw a few years ago with measles in Ukraine, how fragile the overall public health system may be in terms of vaccines. COVID vaccination in Ukraine was around 30% before the conflict. And then, of course, in terms of infectious diseases, Ukraine is number 2 in the global European region for tuberculosis and for HIV. It is around 260,000 people living with HIV and 150,000 people on antiretroviral treatment. And for tuberculosis, it is a high burden country in Europe and globally, and a very high burden country for multi-drug resistant tuberculosis. And we know that interrupting treatment in patients with tuberculosis is really the number 1 factor that leads to multi-drug resistant tuberculosis, which itself is very difficult to treat and, of course, a contagious disease. So that is one of the first issues, I think, that as an international community, together with the national public health system in Ukraine, we sort of are all trying to address. And I must say, I am amazed to see how rapidly we could put in place effective systems to, except in the hottest spots of conflict, ensure continuity of care. So my third point and second part of my answer to you, what it is that people see and don't see, I think what people do not realize is that Ukraine is both a devastating scene of bombing, terror, death, suffering, and at the same time, areas of almost normality because of the extraordinary commitment, mobilization, courage, resilience, adaptation of people. I don't know whether, I'm sure our people participating in this webinar have been struck as much as I have been by the calm and positive tone of Tetiana at the beginning of her intervention. And that is what I see. I spoke this morning with the head of the HIV center in Donetsk, one of the separatist areas, who told me that she yesterday went to Mariupol to bring some patients, HIV patients from Mariupol to Donetsk. Can you imagine all of us looking at our TV screens and seeing what is Mariupol? Can you imagine a physician going there and going back with, so this is absolutely remarkable, and at the expenses, of course, of the risk for lives. Not long ago, and he's not the only one. One of the a member of a major NGO delivering care for HIV was killed on the route to Kharkiv, while he was to deliver some opioid substitution therapy there. So what we do not see is, I think, or do not see and do not speak enough of, is this remarkable resilience, effort, commitment. And the last point, and I hope we'll come back to that, is maybe we're not talking enough about the broader impact on health. This conflict, as the Syrian conflict, as any conflict, will have major economic consequences. And we know that economic downturn means increasing inequities, and increasing inequities means severe impact on health. So I think we can anticipate a major health crisis in the months and years to come. Of course, in Ukraine, as it will be reconstructing, but also in the Russian Federation. And I'm talking here about the people of Russia. I'm not talking about their politicians. I'm talking about the people of Russia. And if you think of HIV and TB, again, on the country with very fragile systems and very tight healthcare budgets. But also I'm thinking of all countries that are economically dependent on Russia in Central Asia, in the Caucasus, that have already seen their currency drop by 50% in the last weeks, and will be, of course, in a hugely difficult position to try and address the healthcare challenges they face. So we have to anticipate on that vicious circle of violence, destruction, economic downturn, increase in inequities, human rights violations, and health impact. That complexity we need, of course, to address as a group of. It's not just a matter of the health sector; it's a matter of the global international community looking at all of these issues at the same time. I'll stop there, Jonathan, for now.
Thank you. Thank you so much. And before we return to Dr. Stepurko, which I know you're all really looking forward to, let me just ask a quick follow-up question to each of you and ask you to be brief in the interest of time. Dr. Sahloul, Tetiana started, as Dr. Kazatchkine said, really talking about the progress, the impressive progress in strengthening Ukraine's health system, in breaking from its Soviet past. Can you comment on what you see as the potential impacts on the health system as a whole, beyond the emergency, including in a context of feared chemical weapons attacks?
We've seen that in Syria, where the life expectancy dropped 11 years within 6 years of conflict. So that should be expected, unfortunately, with the influx of injured patients, the resurgence of infectious diseases like measles and COVID. Ukraine has one of the lowest vaccination rate of both measles and COVID. And also, of course, the impact on non-communicable diseases and mental health. But also something that people do not pay attention to. I mean, Ukraine, like Syria, had the healthcare was very centralized, based in Kyiv. So all of these centralized, and I know that the reforms have impacted the centralization and moved more to local governance, but there is still a level of centralization that will be disrupted by the conflict. So you will have supply chains that will be impacted. When I was in Lviv, I was told that there is a shortage of insulin for diabetic patients. This is something that we don't connect to conflict, There will be shortage of medications for hypertension and TB and COPD and asthma because of the disruption of supply chain, and also because every city and every hospital will be working on their own to, first of all, to make sure that they have enough supply for their patients because of the disruption of the supply chain and lack of coordination. And we've seen that right now because many hospitals are sending lists of supplies that are needed to the United States instead of sending them to the Ministry of Health in Kyiv. So this lack of centralization and disruption will cause a lot of impact on the long term. Chemical weapon is something that we've seen in Syria more than 300 times. Nerve gas, sarin gas, I think all of us are familiar with the Ghouta massacre that killed 1,600 people, most of them are children. The impact on healthcare providers is huge because we're not equipped as doctors. I'm a critical care specialist in Chicago to deal with chemical weapons. We don't get training in medical school, all that. In the last mission in Lviv, I did training because of our painful experience in Syria on chemical weapons to more than 220 physicians in 3 hospitals. And all of them had many questions. They're not equipped to deal with, they don't have decontamination units, they don't have antidotes, they don't have PPEs to protect healthcare providers. These issues have to be addressed if we need to be ready. Russia can use chemical weapons. They have used it to kill political opposition figures. They have used it probably in Chechnya. They knew that it was used, choking agents and nerve gas in Syria, and they kind of approved it. So they may use it in Ukraine. I hope that we won't have that day, but they need to be prepared. Hospitals need to be prepared in Ukraine.
Thank you. Thank you. Michele Heisler, my quick follow-up question for you is about the accountability issues. We've all spoken about that. I can imagine the incredible difficulty working as a frontline health provider and also at the same time trying to bear witness and document abuses. And yet if we don't, the cycle of impunity continues. Can you reflect on that extraordinary tension for us?
Yeah, absolutely, Jonathan. And this is a great challenge. I mean, obviously the top priorities are to save lives immediately and protect those trying to help. As I noted before, though, many of the injuries are from war crimes, from deliberate attacks on civilians. So as I stressed before, we also need to gather and preserve irrefutable evidence for deterrence and accountability. So what does that mean? That means that often clinicians and others responding also must be aware of how, if at all possible, they can also document and preserve high quality physical and psychological evidence to establish what happened. And they need to do this while also ensuring they do no harm. They need to obtain informed consent and preserve confidentiality. And so as a doctor examines a victim, if she also wants to use her history and physical exam as a form of evidence that could be used in criminal cases, she needs to make that absolutely clear. And so that's fundamental. But there, there are ways to do this very quickly, and this is a lot of what PHR does. And I see that Parveen Parmar is on the call, and she's one of our trainers who has done incredible work in doing that. And so there are ways that you can provide, brief training, provide the tools that as you're doing the exam, you're also gathering evidence. And this is so important because medical legal evidence is very, very important in criminal cases against perpetrators. And we saw that just recently in the successful case in Germany. That was against the Syrian Anwar Raslan, but under universal jurisdiction, he was sentenced to life imprisonment for his crimes against humanity in Syria. So first responders can provide crucial evidence by linking physical and psychological evidence to the survivor's report of events. And I will also just quickly note that, again, you're trying to provide care, but there's also a lot you can do by providing crucial documentation through taking forensic photographs. And I'll put into the chat a guide that we at PHR have created just about, okay, you're providing care, you have your smartphone, you're ideally ideally situated to take photographs and videos. So there are things that you can learn. You need to be sure that you have the settings on that show date, time, geo coordinates. How do you take pictures or videos so that they can be used as evidence? How do you take images that can link the damage to the perpetrator, like the type of weapon used? So again, these are you're providing care, but you have your smartphone there. And again, I will say that there are groups, as Tetiana said, there's groups working throughout Ukraine to provide training in the clinical care, but also how do you document? So PHR has been working with local partners in Ukraine about, how do you think about while you're providing the care, making sure you're also documenting this as evidence. So just quickly in conclusion, so it is important, it's critically important, it's most important to treat and provide care, but it's also possible to document what happened to be used for accountability and deterrence. And again, there's a lot of clinicians throughout Ukraine that are remarkably working to do both. And I imagine Tetiana can talk about some of those efforts to network and do trainings. Yes, thank you.
No, absolutely. Thank you for that. And before I go back to Tetiana, Michel Kazatchkine, look, we all know that Russian aggression in Ukraine did not begin on February 24th, that the Russians occupied the Donbass almost 10 years ago. You were there, you were instrumental in helping to ensure continuity of care. But before we go back to Tetiana, can you briefly just help the audience situate this in that larger context? And if you wish, speak about the particular needs of people in the occupied East.
Yes, I guess we can draw lessons or maybe unfortunately also anticipate on some what may happen in occupied territories by the Russians in the next months. The takeover of large parts of Donbass by separatists and the invasion of Crimea by Russia and annexation of Crimea by Russia was followed immediately and within weeks by major disruptions in access to care. Unintended disruptions, of course, from one perspective, that is, that in the Donbass, HIV, TB treatments, where we faced shortages within just a few weeks after the changes. But let me talk about intended disruptions. And the example here is opioid agonist therapy or opioid substitute therapy for people who are dependent on opioids. And I see in the chat a number of comments on opioids and drug use. So as, of course, as in many countries in Eastern Europe, the HIV epidemic in Ukraine is highly linked to sharing of needles and transmission among people who use drugs, who inject drugs. And as you would all know, there is one effective mean to both treat opioid dependence and also prevent HIV transmission among people who inject drugs. That is opioid substitution or opioid agonist therapy with methadone. Now, this is not recognized by the Russian Federation. And this is where we see that health is politics. Russian annexation of Crimea was somewhere, if I remember, around the 20th of March 2014. Almost 1 week or 10 days later, Minister Lavrov was himself in Crimea and said, from now, people have to stop their opioid agonistic treatment, and that within 6 weeks, which is something impossible and against all of the standards in healthcare about how you may decrease doses of that medicine. And so the suppression, the discontinuation, the intended discontinuation ended up with huge suffering and many deaths from overdose, deaths from suicide. And that was several deaths, and according to the Alliance for Public Health Ukraine, maybe over 1,000 deaths in Crimea. So 2 messages from there. This is what may happen if Russia stays in some of the parts of Ukraine beyond the areas where it is already currently determining the fate of people. And second, it shows that policies are determined at political level, unfortunately, irrespective of the best healthcare standards that international organizations like WHO are disseminating, saying that this should be the treatment. But then if a country decides that for one or the other reasons, and I won't go into the detail, they consider this is not a treatment they accept, then that leads to huge suffering and despair.
Thank you so much, Dr. Kazatchkine. So we began, Tetiana, with you describing the context, but also expressing your appreciation for the international solidarity and expertise, which we saw such profound evidence of with the 3 speakers we just heard. Let me bring it back to you. I know everyone's eager to hear from you again. How would you like to react to what you've heard from the other speakers, and what other key messages would you like to share with our audience today before we conclude the event?
It's great to hear a lot of experience is already there, and it's kind of unfortunate that this experience is there, because without the wars in other countries, perhaps Ukraine would not be so effective now, having like today the request to partners, and then tomorrow or in a day getting the training for medical doctors or some supplies which are needed for military or for medical doctors. So I believe this kind of great experience and knowledge that the world and the global community is important to share. Indeed, and that's great that we are already doing this now. And perhaps I would like to continue Dr. Michel Kazatchkine message that we will see a huge economic downturn. And unfortunately, as we saw previously, if we are suffering economically, such sectors as healthcare, culture, and education are the first where the funding is cut down. And me as a person who is working in education and somehow in public health, it's certainly we understand that these areas are about development, first of all, developing human capital through education, developing health of people. And if we do not fund these areas adequately, then perhaps we do not get these results in terms of development of country. So I really hope that because perhaps from my perspective, it works pretty well when our European and Northern American partners, institutions communicate to Ukrainian government about the importance of protecting these budgets for education and for healthcare. But at least at the moment, I see that it's not happening. At least what I hear from Ministry of Health, that no additional funds are available for those family doctors or other doctors who moved from occupied territories to more less affected by the war zones. Perhaps continuing also the line of education, because now I'm more working in medical education development project funded by the Swiss Confederation. We indeed started focusing more on simulation approaches in medicine, and I believe that was kind of trend of last maybe 5, a bit more years. And especially now with the prosecution, with the many other things, some of the medical universities that adopted these approaches now are extremely efficient in terms of saving lives of those who are in army, in territorial defense, and in other areas. So all these mannequins, all these technologies, all the trainings that they are medical educators obtained before the war, and with this equipment, it shows the results, but I'm not sure whether the policymakers and fund holders really see this connection between education and our strengths as country. And perhaps going more into experience of after 2014 active military situation in the eastern part of
Tetiana, I think her internet might be. Oh, there you're back. Sorry, we lost you for a second.
No. And now I get the message that my internet is not stable. Sorry for this.
We have to conclude soon, so maybe just one final point, also in case the internet is unstable.
So I wanted to mention that the rehabilitation that started being developing perhaps also last 5 years before the war, but it was rather, I would say, slow in development. Perhaps now would be much more fast in terms of services, provision, and professionals who are involved there. And it's not just about the army that would need to get this kind of rehabilitation, but also about many people who suffered trauma and all these mental really aspects of staying in very uncertain and very unpredictable environment. Thanks.
Thank you, and thanks to everyone. This has been an exceptional conversation. It's been my pleasure to moderate, but we're very fortunate to be joined by the chair of the department, Howard Hu, who will conclude the event for us. Dr. Hu.
Thank you very much. We only have a bit of time, but the sobering assessments that were given were just spot on, especially those that address the malevolence of attacks on civilians, hospitals, clinics, and providers. Having served on PHR missions before that have documented the impacts of chemical weapons, the emphasis on being prepared, not only for treatment, but for documentation is key. I think it also needs to be said, as articulated by the speakers, the courage of what we have witnessed of those in Ukraine is just astounding. And I think the final message that needs to be shared is to assure our colleagues and friends in Ukraine and in the neighboring countries that are working so hard to provide support, and even our colleagues in Russia who are opposed to the war and can see the injustices and terrible things that are ensuing, that we are in solidarity and do whatever we can to bear witness and help. Thank you.